All right, let's see. Jeff, Chicago, Illinois. I know you're not listening on WLS because it's tape delayed there, but WLS Country, how are you listening? Or did you just pick up the phone?
Can you hear me?
I can hear you, sir.
Oh, okay. Sorry. Yeah, I'm driving, actually, from Chicago to Detroit. But I heard you talking earlier about the government not knowing how to make pencils, and then you talked about brain surgeons, and I happen to be a brain surgeon. So I found your topic quite interesting and actually just returned from Washington, D.C., where we were reading over what the Obama health care plan would be for advanced neurosurgery for patients over 70, which we all found quite disturbing because as our population gets older, the majority of our patients are getting over 70 that require stroke therapy or aneurysm therapy. And basically what the document stated was if you're over 70 and you come into an emergency room and you're on government-supported health care, that you get comfort care. And
wait a minute. What document and where did you? What's the source for this?
This is Obama's new health care plan for advanced neurosurgical care.
And who issued this? HHS?
Yes. And basically, they don't call them patients, they call them units. And they call it ethics panels or ethics committees would get together and meet and decide where the money would go for hospitals and basically for patients over 70 years of age that advanced neurosurgical care was not generally indicated.
So it's generally going to be denied?
Yes, absolutely.
All right, let me ask you this. Is this published? Go ahead.
If someone comes in at 70 years of age with a bleed in their brain, I can promise you I'm not going to get a bunch of administrators together on an ethics panel at 2 in the morning to decide that I'm okay to do surgery.
Let me ask you this. Is this published somewhere where the general public, in other words, a pedestrian like me, can get a hold of it? No?
Not yet.
So this was discussed just with your community of neurosurgeons?
Yep, exactly. The AANS and CNS, the American Association of Neurosurgeons, and the Congress of Neurosurgeons, because everybody knows cuts are coming in medicine and reimbursement, and we're the most expensive out of all the fields in medicine, and we're the smallest field. But at 2, 3, 4 in the morning, we're the ones that are in the operating room, and we have to wait for an ethics panel to convene, which are not made of physicians, which are made of administrators, to decide whether a patient should receive our care.
So Sarah Palin was right. We're going to have these death panels, aren't we?
Oh, absolutely. I'm German by heritage, and I've read the Rise and Fall of the Third Reich, and basically if they don't call them patients, they call them units. And if you're a unit above a certain age, you get comfort care instead of advanced neurosurgical intervention.
Now, this you went to a seminar in Washington, D.C.?
Yeah, where a few of my former partners, 2 of them have gone to work for, one is running the VA system, and one is head of the Congress of Neurosurgeons out of D.C.
And this information is based, you're certain, on representations and information provided by HHS and other government officials?
Yep.
And when will the rest of us become aware of it? After the election?
Probably. I mean, there's so many things that the government keeps under control that are used in surgery called HUD devices or humanitarian use devices that we're allowed to use now because they haven't undergone full FDA approval. And they're just used in surgery because people know it's the right thing to do, but the government can step in at any time like they did 2 months ago with the device and said, this device hasn't met what we want, and there's no exact criteria, and then they can take it away from us.
And the people telling you what to do, they don't know how to make a pencil, do they?
Oh, exactly. That's what I'm saying. And, we always joke around, it's not brain surgery, but, I did 9 years after medical school, I've been in training 10 years, and now I have people that don't know a thing about what I'm doing telling me when I can and can't operate.
All right, Jeff, please keep in touch with us. Well, yeah, I have to go, but this was a very, very crucial call. Janice, West Palm Beach, Florida. Where are you listening to us on West Palm Beach, Florida?
I'm listening.
I know you're listening, but on what? How are you hearing us?
94.7.
And the call letters?
And I don't know. I'm in the car listening to you.
WJNO?
Possibly. I don't know. I just know it's 94.7 on my car radio.
All right, thank you. Go ahead.
Yeah, I believe that they're going to purposefully bankrupt the hospitals to create a vertical monopoly. What happens is that they will put everybody on this government plan. They will flood the ERs with low-paying or non-paying patients, which will then bankrupt the hospitals, just like they bankrupted the banks. And then they'll come in and tell the hospitals, I'm sorry, you bankrupted yourself, but you can't manage yourself, and they take over the hospital. So then they have a vertical monopoly, which is they own the hospital, they own the insurance, and they own the patients. And if there's no private hospitals allowed in this plan, then the doctors have nowhere to go. Then they name the doctor's salary. So when they have the doctor fix in this health care plan where they didn't count for the physician's salary, it's because they didn't plan on paying the physician's salary. As he had.
All right, let me help you out as you go down your list of 15 things that they're going to do. They don't need to do one at a time. If the Supreme Court empowers Congress to order us around, then they go right to the patient and they order us around. If they can order the patient around, they can order the doctor around. If they can order the doctor around, they can order the hospital around. See what I'm saying? And by the way, it's WPHR-FM. I apologize. Go right ahead.
Oh, thank you. And that does leave the doctor in a very precarious situation because if they own the hospital, the insurance, the patients, and now they tell the physician what he can and can't do. It's
not only telling the patient what they can or cannot do. You know what's coming, Janice?
What?
Assigning patients geographical areas.
Oh, correct.
Assigning doctors geographical areas. They're going to argue, just follow me on this. This is why Obamacare and this Commerce Clause individual mandate thing is so diabolical. What they're going to be able to do is to assign doctors to different towns, different states, Indian tribes, different this, different that. And they're going to make the case that you like your license? We subsidize this, we subsidize that, we subsidize this patient. There's some financial connection to whatever you're doing. Even though you may not actually be taking Medicare and Medicaid, the argument would be the fact that you're not taking Medicare and Medicaid patients affects interstate commerce, just like the farmer growing wheat, right?
Correct.
The farmer growing wheat in the 1940s. He said, I'm not involved in interstate commerce. I grow wheat, but I'm not involved in interstate commerce. And they said the fact that you're withholding wheat affects commerce. Well, the fact that you're withholding services affects commerce. I see it all opening up in front of my eyes. Totalitarianism isn't hard to see. It's hard to fight.
Correct. The other thing that I noticed was that if you want to bankrupt the hospitals faster, you would unionize the nurses. And in Florida, they just announced that 12 Columbia facilities are going union, which I find interesting because I worked at Columbia facilities before, and if you mentioned union at any other time, you were fired, basically. So I find it very interesting that they've now agreed for 12 of their Florida facilities to become union.
All right, my friend. Thank you for your call. Beautiful West Palm Beach, Florida. Paula, Cleveland, Ohio, listening on the great WHLO. Go.
Hi. The AMA, American Medical Association, just had a symposium in Chicago this last week, and there were government physicians there, officials, etc., and the conversation came up that there are already some primary care physicians that are on this board, that rather than going to somebody that has a specialist, if you're going to a primary care doctor, they wouldn't know how then to treat, but they're not going to make a referral to who you need to treat.
I'm not fully understanding. What boards are we talking about now?
You know, the neurosurgeon was just on.
Yeah. So he's saying you're saying these boards are not made up of neurosurgeons.
Well, no, but, okay, he was a neurosurgeon, but I'm saying the American Medical Association just had a meeting this past week, November 16th, 17th, 18th,
I got that, but what is this board? Every hospital has a board?
Oh, every hospital has a board.
And no, ma'am, what I'm trying to get to is the treatment issue. Every hospital has a board that decides on treatments?
Oh, no. The people that were at this panel from the government are already
Yes.
on this government board or whatever you want to call it.
Okay, there is a government board of so-called experts, yes.
Right, and they're primary care physicians versus...
Okay, so they're not experts. And not only that, they're political appointees.
Correct, there you go. Thank you.
All right, so you have political appointees who are not experts in every field. It's not possible. And they sit there and they're passing judgment generally over what kind of treatment's going to be available to those who receive government subsidies, whether it's Medicare, Medicaid, VA, S-CHIP, and so forth, correct?
Right. So now that really has me concerned.
Well, it should, because this brain surgeon just said they were meeting in Washington, D.C. They had officials from the government there, HHS, talking about 70-year-olds and above as units, not individual human beings, not citizens, units. A unit is even worse than a subject. You want to know why? Because they're dehumanizing these people. So if you're 70 and older, according to the HHS, ladies and gentlemen, you're now a unit. And if you have a problem with your brain, like a stroke or an aneurysm or something, the word's gone out. You have to have a committee of administrators and so forth. We're going to take a look at the situation. But as a general rule, the goal is to make you comfortable. No aggressive treatment. Now, let me tell you something. Thank you for your call, ma'am. If you've had a stroke or you have a brain aneurysm at one level or another, that is, it's there or it's already exploded and so forth, you need aggressive treatment. So there you have it. You still want to laugh at Sarah Palin? You still want to pretend that universal health care is nirvana? You still want to pretend that your government's compassionate? You're going to be begging for the insurance companies. You're going to be begging for the system that exists today. But there's going to be one problem. If we lose this election, or we elect the wrong Republican, this thing isn't going to go away. It's going to metastasize and get bigger and bigger. You already have the government telling you what kind of toilet you can have, what kind of shower head you can have, and on and on and on. Wait till they get into the medical field. They're already in it. Heavy duty. But wait until they control it. And not only that, imagine if the Supreme Court, if Justice Kennedy decides, you know what, I want to show all my friends at the opera how progressive I am. And I want to go down as history. It's one of the great justices of all time. So I'm going to uphold what is clearly not in American history, or in America's psyche for that matter, and that is empowering the federal government where the Constitution does not, to dictate what the individual shall and shall not do. We'll pretend it's commerce, of course. You know, folks, liberty is something you always have to fight for, in small ways and large, always. Because tyranny is always on the march.